Hey y'all, it's me, Van Lufa. I am watching and recapping the Derek Chauvin trial, so you don't have to. Today's, I guess right now it's Saturday, but these were actually things from day 9. I'm still in my scrubs because I work every day of my life and don't really do anything else, so I'll show you a little scrub of the day. It's ice cream. You've probably seen this one before. So let's go ahead and get into it. Okay, day 9 of the Derek Chauvin trial, which was April 8th, 2021. Right out of the gate, they had a motion by Eric Nelson. He just stated that the state is calling in medical experts. They're relying a lot on Dr. Baker's results, who is the medical examiner. And he just wants the records to show that the state is also calling Dr. Baker to testify. I don't know why that's important, but it must be. State's witness number 30 was Dr. Martin Tobin. He is a pulmonologist in Chicago. He just talks about what he does. He works in critical care in the ICU. He has been a physician for 47 years. He went to medical school in Ireland. He is also responsible for setting up the very first sleep labs in America. He has done research since 1981. He has authored a textbook on mechanical ventilation. He has published 9 other books on the lungs. He has published more than 750 research papers. And he has lectured in more than 30 countries around the world. So, needless to say, sounds like this dude is qualified. He's not getting paid to do this. So he reviewed the medical records and videos and the whole shebang. His professional opinion is that he died from hypoxia or low oxygen. It caused damage to his brain and put his heart rhythm into PEA, which, if you remember, is pulseless electrical activity. But the low oxygen also can be called asphyxia. He stated that the cause of the hypoxia or the low oxygen was from shallow breathing. Exhibit 950 was a picture of the lungs, and he kind of explained the anatomy and all that good stuff, what it does. They asked what caused the shallow breathing. He stated being prone, handcuffed with a knee on the neck and back. He explained what dead space was in relation to the lungs. Exhibit 949 was an illustration of the incident. It was kind of a 3D picture of the incident based from, still photos and videos. And it was kind of cool the way it was set up. And then he also removed the car out of the illustration, so you could see exactly, all the positions that the police officers and Mr. Floyd were in. He stated that the knee was on the neck 90% of the time, and the knee was on the back 43% of the time. When he was going through this footage, he only focused on the first 5 minutes and 3 seconds, since that is how long it takes to get a brain injury. He also is an expert in physiology and deals a lot with forces. He also said that you can see in the video that the handcuffs are so he's cuffed, and you can see Mr. Chauvin shoving his hands and his handcuffs high into his back. And he also talked about how the street was very important in this situation, because the street is hard. And he described that the left side of his body was in a vice. And he gave example of how Mr. Floyd several times tried to expand his chest wall to get more breath in. I'm not sure if I talk about it coming up, but since I mentioned that, I will just give some examples that he talked about. At one point, you see Mr. Floyd lifting his head up and even squishing his face, using his nose to try and push his chest up so he could expand that chest wall to get more air. At one point, you see him put his right shoulder up, also to try and expand his chest to get more air. At one point, you see him lean on the tire with his right hand for the same purpose, trying to get his chest up to expand to get more air. And finally, there was one point that he had his right hand down, pushing down onto the street, his fingers and his knuckles, again, trying to lift himself up off the ground a little bit so that he could expand his chest and get some air. He said because he was being crushed on that left side, it gave him little opportunity for him to get any air into the left side of his chest. Okay, and here's where they talk about Exhibit 944 was his left hand is being grabbed by the officer. And then this is where he talks again about the street being a major role in him being able to expand his chest. They showed pictures like what I talked about with his fingers and knuckles against the street. A picture of him trying to lift his shoulder. He said the knee on the neck is important because it prevents air getting into the trachea. He also talked a lot about the hypopharynx, which is located in the neck. Exhibit 937 was a photo of the hypopharynx. Also, Exhibit 935 was a picture of the hypopharynx with a coin in the picture to just show the size of the hypopharynx. It's about the size of a dime. He did state that according to video, at different times, Chauvin was applying force to the hypopharynx. Another photo, like I mentioned, was him using his nose, forehead, and chin to try and get himself up to get air. Exhibit 946 was just a photograph of the effects of airway narrowing. And let me tell you, this guy had so many illustrations of everything. It was extremely evident this man was extremely knowledgeable. He talked forever. He just talked about the mathematical relationship between pressure loss, flow, and stenosis, which is airway narrowing. He showed a formula for this as well. By this time, this is all going over my head. More pictures of the knee on Chauvin's back. He did state that he continued speaking for over 4 minutes. So he spoke for 4 minutes because his brain was still getting oxygen. They took a mid-morning break. They looked at more pictures of the knee on the neck. He also stated that the prone position causes narrowing of the hypopharynx. They showed another picture of lung function. He talked about tidal volume. He calculated Mr. Floyd's lung volume. Talked about the volume, regular breath is 400 cc's apparently. Tons of calculations and illustrations. I could talk all day about this. I wrote discussing more stuff about lung volumes. Then he talked about the weight that was placed on his back. Okay, so what he was talking about were studies. So there have been studies done of the effects of somebody that has had weight on their back, just for scientific purposes. But there are no studies of weight being placed on a neck because those studies would not be ethical. They talked about Mr. Floyd having pre-existing health conditions. And he said that even if it was a healthy person with no pre-existing health conditions, they still would have died just from the force. He apparently also had a paraganglioma tumor. He talked about the effects of that. Then he discussed the statement, if you can speak, you can breathe. He just said there just wasn't total occlusion yet at that time. So that's why he was still speaking. Another video clip. Okay, so this is where they showed what was a myoclonic or a hypoxic seizure. I believe he also called it an anoxic seizure. And that was at one point where you saw on the footage his legs go up and then Officer Lane pushed them back down. That was actually a seizure that he had from the lack of oxygen to his brain. He did suffer severe damage to the brain because of that. Okay, I wrote, showed more pics, more talk. So he used footage to be able to count his respirations. And before he died, his respirations were 22 a minute, which is normal. Generally, fentanyl suppresses respirations and decreases the respiration rate. And so that was not the situation at this instance. And then he talked about how there was a gap of 9 minutes and 50 seconds between the time that he took his last breath and the first breath by the paramedics when they put in that artificial airway. Then there was a lunch break. On cross-examination by Eric Nelson, he said, you were approached by the state of Minnesota to review this case. Yes. You volunteered at no cost. Yes. This is your first involvement in a criminal case. Yes. What are your fees normally? $500 an hour. We are all in the wrong business, people. He said, you are not a pathologist, correct? No. He talked about submitting his report on January 27th of 21, and then he met with the state lots after that. He wanted to make him aware or remind him that every time he met with the state, there were notes that were prepared from that meeting. And that Eric just got all of those notes from all of those previous meetings last night. So what he was trying to say was, you've had a ton of time to prep. I have not. He said you talked a lot about physics. A lot of physics are always changing. Yes. Pathologists look at things beyond that. He asked if he reviewed the autopsy. Yes. He stated there was no bruising to the skin and there was no injury to the hypopharynx. And he said no. And then he basically said it doesn't matter. He talked about the calculations that he made on Mr. Floyd are theoretical. He couldn't possibly predict how much weight and force was being put on Mr. Floyd at the time. And then he said your calculations are based on healthy individuals. And he said my calculations were based on men of the same age and height. He asked in the prone position if a stomach was bigger, then the amount of force being pushed into the lungs was greater. And he said yes. He talked about Mr. Floyd having heart disease and narrowing of the coronary artery. And the physician said if that was the case, he'd have chest pain and rapid respirations, and we didn't see any of that. He said, Eric said, so he has a history of high blood pressure and COVID. He recently had COVID in March. He said, but the treatment of the prone position, or the treatment of COVID is the prone position, right? And he said, yes. But that is a treatment when they have active COVID. Mr. Floyd did not have active COVID. They talked about he had nicotine in his system, which changes his lungs. They talked more about the fentanyl, how meth increases the heart rate. They talked a lot about adrenaline, how it can increase the heart rate. The tumor that he had can increase his adrenaline. They talked about chronic use of fentanyl can make the chest wall more rigid. Yes. They talked about the pills that were found in the squad car. They talked again about the anoxic seizure. Like I mentioned, how he kicked his legs at that point. On redirect, they said Mr. Chauvin was on his neck for 9 minutes and 29 seconds. Did you ever see him during that time get off of his neck? No. So things weren't constantly changing? No. He said with the hypopharynx, you wouldn't expect any injuries to be found. Why not? Because he said changes won't be there. The same with the bruising. So apparently there was, on the autopsy, there were no changes to the hypopharynx. There was also no bruising on the back. And he said they didn't have to be there for it to be that kind of a death. He wouldn't expect any, is what he said. It had to do with static forces. In your professional opinion, do any of his health conditions have anything to do with his death? He said not at all. And there is no evidence of death from any illegal substances. On cross-examination, they talked about how and this was funny because I should have noted this before. I was like, this guy is such an expert. Like, I mean, he's been a doctor for half a century almost. And I thought, poor Eric Nelson has to go against him and try to discredit him. That would scare the crap out of me. Okay, anyway, Eric was saying, but his carbon dioxide level was at 89. And, okay, so originally, the physician said his carbon dioxide level was 89. And Mr. Nelson said, but it was measured at 103. And the doctor was like, that was venous blood. You have to look at the arterial blood. So he's kind of poo-pooing him off like, okay, the wrong blood. He asked, can fentanyl cause death by low oxygen to the brain? He said it would have to cause respiratory depression. He got a little mad. He asked him again, and he goes, yes. On redirect, they asked, do you go into a coma from a fentanyl overdose? Yes. Was Floyd in a coma? No. There was a break. State's witness number 31 was Daniel Eisenschmidt. He is a forensic toxicologist for MNS Labs in Pennsylvania. He talked about the different jobs he's had over the years, his education, his role at the lab. He reviews approximately 7,000 to 8,000 cases per year. They tested blood and urine on Mr. Floyd. The findings showed in his blood there was presence of fentanyl and meth. The level of the meth in the blood was consistent with a prescription dose, so they said low level, yes. In fentanyl, levels can vary widely due to tolerance. He talked about what tolerance is. They also found nicotine and marijuana. Exhibit 624 was the toxicology report. So his blood and his urine were also positive for those things. They talked about opiates in the urine. So basically, opiates stay in the urine longer than they do the blood. Apparently, there was also morphine found. Oh, there was morphine found in the urine. That was it. So there was morphine found in the urine, but not in the blood because it stays in the urine longer. Caffeine was also present. They talked about some of the substances were below the threshold, so they did not report them. So there are standards. There's what's called a threshold, and a substance has to be more than what the threshold number is in order for it to be reportable. So what they were saying that there were other substances that were in such small, minute amounts that they did not report them. He also stated that in post-mortem samples, concentrations of drugs can be higher. So they had to take that into consideration. They talked a lot about the fentanyl, the metabolization of fentanyl. I wrote they showed tons of graphs. All of this to say, after they went back and forth forever, All of this was to say that his fentanyl concentration was low. On cross-examination, he talked about the lab accreditation process. He talked about the threshold. It's not common to report under threshold because it's against accreditation standards. He said yes, without an explanation. He prescribed fentanyl. And, so he described in the pharmaceutical fentanyl prescriptions, the amount of fentanyl is very controlled, very predictable in a test. But in street fentanyl, you don't always have control over the amounts of fentanyl that go into the pills. And then he discussed again the pills that were found in the squad car. They took another break because, of course, they took a break. Once the jury left on this break, because there was a big cluster, Mr. Nelson was trying to ask questions from some document that apparently wasn't up to date. So they let the jury go, and then then Mr. Nelson was just talking about how he did not have the updated slides. He had an earlier version. He was just frustrated. He was getting information in different formats, and it was just frustrating to him. So during that break, they got him the correct paperwork that he needed. Okay, they were talking about, they showed a slide on postmortem fentanyl cases. Not all are fatal, so it's hard to compare. And then they were comparing the fentanyl levels to people who have fentanyl in their blood for DUI cases. And so they were comparing fentanyl levels in those dead versus alive, so they weren't comparable. On redirect, they just asked, did he follow all standard procedures to do all of the toxicology reporting? He said yes. They did not report the under the threshold data, but they do maintain those records according to protocol. They talk more about fentanyl. On cross-examination, so basically what he was talking about was all of the death rates that he had on some of those slides with fentanyl. And Eric was basically saying, how can you compare? Oh, you got to see my laundry pile, yay. He said, how can you compare these deaths, all these fentanyl deaths, when you don't know how these people actually died? Were they fentanyl overdoses? Were they gunshot wounds, but they happened to have fentanyl on board? So we just didn't think that that information was very reasonable. State's Witness 32 was Dr. Bill Smock. He is an emergency medicine physician, and he's also specialized in criminal forensic medicine. He talked about his education. He's been a doctor for 21 years. He has expertise in asphyxial death. He edited 4 textbooks in his field. He was an assistant medical examiner from 91 to 97. He studies forensic medicine in the living versus the dead, which is interesting. I didn't even know that was a thing. His current job now is he is a police surgeon for the Louisville Metro Police. He is also the director for the Institute of Strangulation Medicine. Didn't know that was a thing. He is also a clinical professor for Louisville School of Medicine. He explained his duties as a police surgeon. He talked a lot about drug tolerance and the definition of that. He is being compensated by the state at $300 an hour. His opinion of the cause of death was positional asphyxia from pressure on the chest and back. He also talked about excited delirium. Exhibit 921 was the signs of excited delirium. There are 10 characteristics, none of which applied to Mr. Floyd. It's a controversial diagnosis. It's not recognized by the AMA or APA. He discussed the toxology report. He discussed fentanyl intoxication versus fentanyl overdose. So apparently one of the characteristics of a fentanyl overdose is constricted pupils. And on 5/25/20, Mr. Floyd had dilated pupils. He talked a little bit about air hunger, and that "I can't breathe" statement is an example of air hunger. A fentanyl overdose does not cause air hunger. In death by fentanyl overdose, a coma state is reached. They said, was Floyd suffering from a fentanyl overdose? No. With an overdose, you get sleepy and you're not alert, and Mr. Floyd was none of those things. Mr. Floyd was a chronic drug user, so he had built up a tolerance. He talked about how this was associated with asphyxia. He also reiterated that you can be fatally strangled and have no bruising. He discussed petechial hemorrhages and how it does not have to be present for strangulation. Exhibit 127 was a video clip of Mr. Floyd going down to the ground. He talked about how his voice changed. He talked about the importance of timing with CPR, and how that as soon as he went unconscious, they should have started it then. On cross-examination, Eric Nelson says, "You're not a pathologist, right?" No. "You're not board certified in forensic pathology?" No. He asked if meth and fentanyl combined could be different and have different effects on people, and he said yes, it could. He said their death can be a little bit different with a combination. He said it can be. He talked about a coma state with fentanyl OD. How long would that last? He said it depends on the person and the amount that they had. He said, on the autopsy, can you see any physical evidence that Mr. Floyd's airway was obstructed? No. He asked a lot more questions. He said, can people suffer brain damage while awake? He said, yes, they can. A stroke is an example. They talked more about tolerance. He asked, when someone stops use for a while, can tolerance be decreased? And he said, yes. On redirect, you were asked about his heart disease and high blood pressure. Was there any evidence Mr. Floyd had a heart attack? On autopsy, no. Was there any evidence of low oxygen on autopsy? No, because he was dead. Was there any evidence of a meth or fentanyl overdose? No. On cross-examination, he said, was there any evidence he was choked from the neck? No. Would fighting with police officers put stress on the heart? Yes. And that is where we ended for the day. Overwhelming, so much stuff to listen to with all these doctors and medical professionals. Very, very interesting, though. The pulmonologist spoke so far over my head that I finally just kind of fast forwarded through little bits of it because I wasn't going to understand it anyway. But anyway, thank you to everybody who's mentioned to me that they enjoy my recaps and that they like keeping up that way because they don't have time to watch the trial. Well, I will say to you, same. I don't have time to watch the trial either, but I'm making it work. So anyway, I haven't watched today's Fridays yet, but I will get that video out to you before Monday. Thank you again so much, guys, for watching, and I'll see you on the next one. Bye.